We've been talking about the urinary system and how effective it is at getting rid of waste products from the body. But there are other tissues and organs and processes that help us to confine, transport, and remove waste products or recycle materials. So let's do just a quick look at some of the other mechanisms of waste removal. So buffers in body fluids bind to excess hydrogen ions and prevent an increase in the acidity of body fluids. So buffers are sort of like trash cans. They have a limited capacity. Eventually the hydrogen ions, like trash getting full in the basket, have to be eliminated from the body by excretion. The bloodstream provides pickup and delivery services, so trash cans have to be emptied, right? So the blood picks up the trash and delivers it so that we can get rid of it. So just like a trash truck or a garbage truck or sewer lines are going to take waste products from where they're created to get rid of them. The liver is a site for metabolic recycling. For example, conversion of amino acids into glucose or glucose into fatty acids. The liver also detoxifies substances into less toxic ones, like ammonia, into urea that can be excreted in the urine. We know we get rid of waste products through the lungs every time we exhale. We get rid of CO2. Your sweat glands, especially during exercise, help to eliminate excess heat, water, CO2 even, and a little bit of salt and urea. And your gastrointestinal tract, as you learned when we did digestive, is going to excrete solid waste, undigested products, some water, and some salts. As we age, the kidneys are going to shrink in size to about losing about 1/3 of their total mass. Also, the blood flow to the kidneys decreases. This is going to result in decreased filtration. The glomeruli tend to become much more damaged and may decrease in number, again, further decreasing flow. So with the blood flow decreasing, that's going to decrease our filtration rate. Usually by the time we're about 40 to 70 years old, the filtration rate is decreased by half. The filtration, reabsorption, and secretion decrease. Kidney disease becomes more common. Inflammatory disorders, kidney stones, much more common as we age. Because we detect thirst less as we age, the older we get, the more likely we are to become dehydrated. So when the bladder is reducing in size, of course, that's also going to reduce its capacity. The muscles of the pelvic floor and the detrusor muscle tend to weaken. So incontinence is much more likely to develop. Urinary tracts become much more common. Excessive urination, especially during the night, may happen. Urination may become painful. Sometimes urine is retained, urine retention. Then sometimes it leaks, incontinence. And also it's much more common to have blood in the urine as we age.